So the first thing is always, I apologize if you can't see me. But I also saw that girl fall down at the Oscars, so it's a trade-off, always. We have a lot of work to do this morning before 10:45, so I know my panelists, and thank you all for being here. And on behalf of the Planning Committee, thank all of you for being here and all of you out there in the ether as well. I do want to point out there was a comment on the website last night saying, why aren't there any patients up here? And I'm pleased to say that today we will have patients participating as panelists. Knowledge generation and care improvement, the research world. I think there are a couple of big trends that are sort of converging to bring us toward a direction that looks more like progress on a lot of the things that most of us in this room care about. Translational science in the research space, there's a lot of talk right now about how we move from the bench to the bedside. There's been less discussion of where patients fit in that translational process. And so I'm hoping we'll talk a little bit about that today. We look at comparative effectiveness research, patient-centered outcomes. All of those things, I think, are beginning to grow in the direction of a critical mass to actually get patients involved in a way that is more reciprocal than what we have seen in the past. One way of framing what we'll be thinking about and talking about this morning is, what do we know? The first question is, who are we? We has been in the research realm typically and historically a pretty limited set of people with, there was some talk yesterday about culture and the important shaping that culture has that can sometimes be invisible to us because we're in it all the time. That definition of who we are when we're thinking about what we know is starting to get broader, and I think that's a really positive development, and I think bringing patients into that definition of we is an important piece. The other issue is what we know. What do we know? How do we know that we know it? And what counts as knowledge? I come from the bioethics area. I have training in philosophy, so all of these questions about epistemology, how do we know it's knowledge? What counts? Those are actually important issues from a policy standpoint. Whose input counts? I just came back from Bethel, Alaska. People in villages of fewer than 1,000 people. Their ideas about what their health priorities are finally beginning to get some currency in the people who are providing services. That's important, and that's an important change. So we'll address all of these issues, and we'll be shaping these around four sort of directed questions. The first thing we'll talk about is what the current state of play is. A lot is happening in the research world that is quite different from the way that things have traditionally been set up, with a bright line between sort of the clinical realm and the research realm. That's getting blurry, and we have not yet caught up with what that means in terms of implementation or regulatory protections. Patient views about what's happening with research, research realities, and then the regulatory environment are all things that will fit under that section heading. We'll also talk a little bit about public and patient opinions. In my own work, and my colleague Yvette Ludman will talk a little bit about some of the work we've done together. People are supportive of improvement. We'll hear a little bit about what they want from us in the research space. And we've traditionally thought of people participating in research. It turns out there's some things they'd like in return. So we need to think about that. Now I'd like to move on to introducing our distinguished panel. We have Dr. Nancy Cass will start us off. She is the Phoebe R. Berman Professor of Bioethics and Public Health in the Department of Health Policy and Management at Johns Hopkins Bloomberg School of Public Health, and the Deputy Director for Public Health in the Berman Institute of Bioethics. Her current research projects examine ethics for a learning healthcare system, including quality improvement and comparative effectiveness, informed consent in randomized trials, ethics issues that arise in international health research, and ethics and public health preparedness. We'll hear from Alice Leiter from the Center for Democracy and Technology about meaningful choice. She's policy counsel for the Center for Democracy and Technology's Health Privacy Project. Her work focuses on developing policies for the advancement, adoption, and implementation of health information technology and electronic health information exchange to improve healthcare. Ken Mandel will speak to us about the infrastructure we need for patient-engaged translational research. He's from Boston Children's Hospital and is an associate professor at Harvard Medical School and the Louis Diamond Investigator at Children's Hospital Boston, where he directs the Intelligent Health Laboratory within the Children's Hospital Informatics Program. He's pioneered and published extensively in the areas of personal health records and biosurveillance. Under a major HHS initiative, he co-leads the Smart Platforms Project, which seeks to create an app store for health. We'll close with a joint presentation from Peter Margolis and Jill Levinsky from Cincinnati Children's Hospital Medical Center. Dr. Margolis is a professor of pediatrics and director of research at the James M. Anderson Center for Health System Excellence at Cincinnati Children's. His work encompasses the application and study of quality improvement methods in a broad range of areas, including primary and subspecialty care, communities, and public health settings to improve the health outcomes of children, families, and communities. Jill Levinsky is currently a clinical research coordinator for the Inflammatory Bowel Disease Center at Boston Children's Hospital and recently completed graduate work in child development at Tufts University. She was diagnosed with Crohn's disease at age 7 and immediately became involved in awareness, education, and fundraising efforts through the Crohn's and Colitis Foundation, for which she served as the Philadelphia Delaware Valley chapter's first youth ambassador and the founding chair of the National Youth Leadership Council. Thank you all very much. I'll turn it over to Alice.